Latin America is worried about the increasing amount of coronavirus cases. But there has been another epidemic silently battering the continent since 2019, dengue fever. The virus has already put a strain on the healthcare system of several countries, and some question the ability of many nations in the region to efficiently cope with the impact of the new coronavirus, while at the same time dealing with dengue cases.
We've had more cases of fever reported in health centers. Since then, and to cover the demand, doctors have been doing double shifts. Lab technicians and nurses are also working double shifts.
In 2019, there was a six-fold increase of cases compared to the previous year. 3 million people were affected. Brazil has the highest number of cases. But on a per capita rate, Central American countries such as Nicaragua, Honduras or Guatemala fare worse. The lack of resources and preventative actions doesn't help in the battle against dengue.
Ellos sabían desde el año pasado.
It's been a year since they know about this problem, and they haven't taken any action.
Tomaron las acciones en forma oportuna.
This disease, contrary to the urban COVID-19, is more prevalent in rural areas, but it is spreading more rapidly thanks to global warming, which allows mosquitoes, the sole vector of dengue, to thrive where they once could not. Now, to the years-old battle against dengue, Latin America will have to add the challenge of fighting the new coronavirus simultaneously.
But not everything about the pandemic is negative. In several Latin American countries, a few initiatives have emerged, and many are especially aimed at helping health workers.
Jorge lives in Buenos Aires. He didn't know what else to do. He was becoming desperate in isolation. But then he found in a 3D printer the perfect way to channel his energy. He started making this face mask that help protect against the fearsome respiratory droplets that can transmit the coronavirus. Following the example of countries such as Spain, he organized a network of volunteers that distributed 500 masks in 20 hospitals in their first week.
The demand was huge. The phone was ringing all the time. Nurses, policemen, private security guards, they were desperate.
In neighboring Chile, the company Codelco also uses 3D print technology to make masks made out of copper, a material whose properties allow it to repel bacteria. Meanwhile, in Mexico, those who don't have access to the same kind of technology try to help in their own way. These women chose to give birth in their own homes in order not to overload hospitals. In this time of pandemic, we must not let anyone behind. That's why the Chepe Se Baña NGO in Costa Rica transformed this van into a portable hand-washing sink that travels the streets of San Jose. It specially visits the most vulnerable areas, not forgetting those for whom water is a luxury.